Qatari Health Surveillance Center is seeking to use information technology in an innovative way in order to prevent the spread of Ebola in Qatar. We, as the Qatari government, have come up with a 5-step plan that needs to be implemented in collaboration with the Saudi authorities for Hajj.
Step 1. Tracking Ebola using wearable technology. One of the difficulties epidemiologists face in gaining control over the spread of a disease is tracking who was in contact with a known infected person during the time frame they were contagious. This is usually done by interviews with family, friends, co-workers, etc. However, this will be error-prone, inaccurate, and time-consuming when it comes to Hajj. Our current proposal involves large-scale manufacturing of low-cost wearable wristbands. Each device has a proximity sensor and a unique identification number. Associated contact information for this device, the name of the person, the passport number, and contact number, is stored in a secure database available to field-level health officials only in Saudi Arabia. When device A is within 10 feet of another device B, both devices will exchange IDs and log timestamp of exchange. History of these logged exchanges would be limited to 1 month. If the owner of device A is tested positive for Ebola, health officials will have access to contact information of all individuals this person had contact with. High frequency of contact individuals can be brought in for testing. Low frequency of contact individuals can be advised to keep themselves in isolation. For this to work, every single pilgrim performing Hajj, around 2 million people, would need to be given this device with no cost. Low-cost wireless control transceivers can be as low as $3 per unit sold individually. Flash stores and 8-bit microcontrollers are in the same price range.
Our second wearable device will be a biostamp, which sticks on a person's skin easily and is water and sweat-proof. This will only be given to the residents of Qatar going to Hajj. The early symptoms of Ebola include, but aren't limited to, fever, severe headache, and muscle pains. The biostamp will help us track the vitals of our residents through measuring temperature, blood pressure, and heart rate. As any pain causes a higher blood pressure, the biostamp will help us track individuals who may have early symptoms. We will track individuals' vitals from the day of departure to 21 days after they arrive back to Doha. This information will be integrated into the Qatari Health Surveillance Center and their system's primary servers.
The next step is prevention and control. One of the major transmitters of Ebola is bodily fluids. The majority of the Hajj pilgrims stay temporarily in shared tents, amongst other public facilities, where they would need to use the bathroom. The Qatari Health Surveillance Center will provide for each pilgrim from Qatar with impermeable portable emergency toilets, which they can easily store in their rooms or lockers. The emergency toilet wraps and seals waste materials and their odors. It requires no water or sewer to operate. After every flush, the next user is left with a completely clean and sanitary toilet because of the continuous roll of film, as the waste material becomes hermetically heat sealed.
The third step is a response plan. This step will consist of booths being installed around the Hajj area. These booths will contain dedicated health professionals that will provide healthcare if needed. There will also be information pamphlets and brochures that provide general information about symptoms and prevention. The healthcare professionals will be alerted if any individual is high risk. They will move out into the field and discreetly take the individual away from the area to perform more testing. When removing the individual, healthcare professionals will follow a protocol in order to prevent potential psychological trauma to that individual. If any case of Ebola is detected, there can be the technology of concrete canvas used for a quarantine zone. A fabric-like tent that becomes concrete once it is hydrated will allow for complete quarantine zones that can be set up anywhere at any time, instantly.